Have you ever noticed that it's more difficult to see driving at night? Well, night blindness or nyctalopia refers to poor vision that occurs in dim light or darkness. Like presbyopia and myopia, night blindness can pose a dangerous threat to driving at night because it limits the visual capabilities of an affected driver. So in today's iSchool, we're going to briefly cover nyctalopia or night blindness, and I'll give you my top 5 tips to make driving at night easier.
Welcome to iSchool with Dr. D, where my goal is to arm you with the knowledge you need to take control of your eye health and have the best vision possible. Like and subscribe for videos every week.
Welcome to Saturday iSchool. I'm your host, Dr. D. Here on Saturday School, we take a look through a different lens at eye health and vision topics. This month, I'm doing an Ask the Eye Doc Saturday where I answer some of the most common questions I get about eyes and eye health. One of the most common questions I get on this channel is about driving at night. Why is it so difficult? What can I do about it? What are some tips that will make it easier? And also, is there anything I should be asking at my optician's or eye doctor's office that they can put on my glasses or lenses to make night driving just more comfortable, more enjoyable, and make my vision better so I feel safer? So to give you a little bit of background, 23% of all injury crashes and 37% of fatal crashes in the US, the United States, sorry. So around 20% of all injury crashes and 37% of all fatal crashes in the United States in 2016 occurred between the hours of 6 p.m. and 6 a.m. We don't know that vision had something to do with every one of those crashes, but it's certainly possible that visual ability at night had an impact in some of those crashes. Road hazards are harder to spot at night when visibility is reduced and light is limited. More light is reflecting off of road signs, making them even more challenging to read. Other road users might be harder to see, including vehicles and pedestrians, and animals are more likely to run out onto the road when it's dark out. The inability to see these types of objects is dangerous for you and for everybody else on the road. So number 1, why is night driving so difficult? Well, night blindness or nyctalopia is poor vision that occurs, like I said, in dim light or darkness. So nyctalopia, this disorder can be caused by cataracts, glaucoma, myopia, and other vision conditions. In some cases, glasses can treat your night blindness, say if you're uncorrected, but treatment ultimately depends on the underlying cause of the reduction in night vision. Headlights, high beams, and fog lights help drivers see at night, but they produce glare and make it harder for you to see as the driver. Our pupils are also bigger in scotopic or nighttime conditions, letting in more light, which means more glare. And ultimately, glare is irritating, distracting, and it can reduce your reaction time. So here are my 5 tips to maximize your night driving ability. The first tip is make sure to control all of your eye conditions to the best of your ability. If you have glaucoma is a disease of high pressure in the eyes. You can check out my high eye pressure video here. But controlling glaucoma is important because it can lead to peripheral visual field loss, which makes driving at night difficult. Macular degeneration causes impairment in the center of your vision. Again, something that you want to keep controlled. If you have wet macular degeneration, making sure that you're current with your retinal specialist, getting shots as needed, because optimizing your vision is important for optimizing your night vision. The third one to consider are cataracts. Cataracts are notorious for causing night driving issues because they tend to make glare kind of go crazy, right? So your pupils are bigger to begin with, and I have a video on cataracts. So we talk about how that occurs in the lens of your eye. And so when more light is hitting the lens that has opacities and defects in it, that light gets refracted all over the place, causing more glare, more difficulty seeing at night. And finally, dry eye. Believe it or not, dry eye does impact your ability to see at night, and we'll talk a little bit more about that in a moment. Number 2, make sure you have your best corrected visual acuity. What do I mean by that? Well, small amounts of astigmatism are notorious for causing problems with driving at night in the rain, but any change in your prescription can be magnified at night due to the larger pupil size and more light being able to enter your eye. So make sure that your glasses and your contact lenses are updated to give you the best visual correction to optimize that night driving. If you have astigmatism, a pro tip is to make sure your contacts are actually correcting for that astigmatism, because many patients I see will have their astigmatism corrected in their glasses, and for whatever reason, it might not be corrected in their contact lenses. So ask your doctor how to best correct your visual acuity to give you the most crisp possible nighttime vision. Tip number 3 is anti-glare. I get this question a lot. Do I really need anti-glare on my glasses? And my response now is yes, absolutely. We now live our lives in such a way that there are very few patients where anti-glare is not necessary, meaning we spend our days on phones, tablets, computers, and then we drive at night with these really, high beam headlights, these really bright headlights. So anti-glare is a lens enhancement. It's a treatment on your lenses that reduces glare given off by oncoming headlights, street sign reflections, and other bothersome light. Anti-glare coated lenses can improve your visual comfort and your clarity, enhancing your vision for a safer night driving experience. Number 4, keep your eyes moisturized. If you think about it, oftentimes you're driving at night after you've spent the entire day working on your computer or looking at your phone. And naturally during those types of activities, we don't blink as much as we should. And so if you have even mild dry eye, this isn't necessarily for my severe dry eye patients, all this is true for them as well. But even if you don't have like diagnosed dry eye that you deal with on a day-to-day basis, it is possible by the end of your work day, your eyes are a little less moisturized than they were at the beginning of the day. So a poor ocular surface is not only uncomfortable, but it's hard to see through. Looking through a dry eye is just like trying to look through a windshield that has water droplets all over it. It's blurry, the light gets reflected everywhere, and it just makes it really hard to see. So if you have known dry eye syndrome, use artificial tears before you set out for your night driving. But also if you work in an office environment and you notice those tired, sort of dry feeling eyes at the end of the day, also a good tip to try some artificial tears before you drive. If it corrects that night driving issue, you know you were dealing with an ocular surface issue. And number 5, this is not really my area, but optimizing your vehicle for night driving. Silly things that seem obvious but worth noting. Clean your windshield inside and out. Just like you can't see through, just like it's difficult to see through a cornea that has dry spots on it, it's difficult to see through a car windshield that has water droplets on it. So make sure your car windshield is clean inside and out. Turn down your dash and your inner console lights on your car so you don't have extra glare coming from that direction. And clean and properly align your headlights, because from time to time that can be the issue as well. So that's it for Saturday school. Thanks for attending. This does count as extra credit, you little overachiever you. If you like this content, please give it a thumbs up, as that helps YouTube know that these videos are helpful to you, which is what I'm trying to be. And if you'd like to be a subscriber, make sure to do that now. I will see you next time.